You've now gotten to the point, you're home, you can't stop your nose from running, you're coughing, your throat's scratchy. When do you go to the doctor? What's that moment?
Yeah, that's a great question. Sometimes it's hard to correctly answer that question for every patient, but there's some real important things to keep in mind. I usually tell patients that, especially for older children and adults, if you're having a fever that's running very high, that's not getting better within 3 days, that's generally a good time that you need to seek care with your physician to make sure there isn't a more serious infection going on. If you're having a cough that's persistent, that's not allowing you to resume your normal activities, that's a concern, particularly if there's any associated shortness of breath with that. I mean, of course, if symptoms are severe, you should seek care at the emergency room, but in general, if you have a history of any type of asthma or other lung disease and your cough is just more than your normal kind of symptoms, then definitely seek care with your doctor. And also, if you're just not getting better, a question I always ask my patients is, today compared to 2 days ago, are you better, worse, or the same? Generally, if they're telling me that they're getting worse over the past 48 hours rather than getting better, and they're kind of 5 to 7 days into a cold, that's usually when I would say, see your doctor, make sure that there's not something more going on.
A very high fever. What's that number? Does it vary for people?
Yeah, it definitely varies. It varies by age as well. I mean, smaller children can run higher fevers for a few days. It's just the way their body best fights off infections. It's unusual, though, to see adults with higher fevers. A fever is generally defined as 100.4 degrees when measured with a thermometer. But generally, if adults are having fevers, my threshold is usually if you're having fevers, 102, 103 as a teen or a young adult, that's usually when I would say seek care at your doctor's office, because we want to make sure there's not something more going on.